Hi, my name is Quinn from HelpAge International. Welcome to my presentation on older people and COVID-19 impact and response in Asia. My presentation will be in 4 parts. Part number 1, who are we? HelpAge is a secretary of a global network of organizations working for the rights of all older people to lead dignified, healthy, and secure lives. Our network has 148 members in 86 countries across the world. Part 2, Population Aging. This is a graph showing the percent of older people aged 60 years and above in key countries in Asia from 1950 to 2050. As you can see, all countries in the region, no matter how big or small, high or low income country, are rapidly aging and are following the aging pattern of Japan. Part 3, Older People and COVID-19, Impact and Response in Asia. As part of an Asian regional initiative, HelpAge International and partners organizations have been producing country briefs on the situation of older people in the 9 following countries. The country brief also document how government and others were responding to the challenge that older people face. In early 2021, HelpAge produced a regional report entitled COVID-19 and Older People in Asia and the Pacific, 2020 in Review, looking back on how the pandemic affected older people in Asia. The report documented some of the key themes that emerged throughout the pandemic and suggests critical gaps that we'll urgently need to address. It became clear that older people was at highest risk. The older population suffer more from the virus than any other age group, experience high rates of death and serious illness following infections. The initial discussion of COVID-19 impact on older people focused on the direct risk of health from the virus itself. But gradually, it became clear that older people were also facing many indirect impacts from the pandemic. The pandemic unleashed healthcare complications that were not directly caused by the virus, as well as challenges for older people's income, livelihood, family relations, social connection, freedom of movement, and how they were perceived by societies. The pandemic affected everyone, but how seriously each older person was impacted reflected the diversities of experience in later life and the inequalities within societies and between countries. Throughout the COVID-19 pandemic, HelpAge supported country office and network members to also implement actions to respond to COVID-19 in 10 countries in the region, which were Bangladesh, Cambodia, Indonesia, India, Myanmar, Pakistan, the Philippines, Sri Lanka, Thailand, and Vietnam. The following are the 4 key recommendations that came out of the intervention. 1. Gather sex and age disaggregated data and other evidence on older people's situation during the pandemic for more effective planning and implementation. 2. To avoid even wider inequality during post-pandemic, countries should invest in systems that can reduce inequality in later life. Third, prioritize national systems that can deliver in a crisis and beyond. Should incorporate universal health care and social protection floor for all. And lastly, include non-state actors during and post-pandemic to promote appropriate, inclusive, and effective response. Part 4, Case Study from Vietnam, the Intergenerational Self-Help Club and its COVID-19 response. HelpAge COVID-19 response in Vietnam is implemented through the Intergenerational Self-Help Club. The ISHC development model is a development initiative that provides control of the development process, resources, and decision-making authority directly to the community groups. The underlying assumption of the ISHC development models are that The community is the best judge on how their life can be improved, and if provided with adequate training, information, opportunities, and resources, they can organize themselves to provide for their immediate and long-term need and development. Moreover, the ISHC development model is motivated by their trust in people, and hence it advocates people full participation and ownership as a powerful force for development. By treating people as an asset and partners in the development process, which will make the model more responsive to local demand, is more inclusive and cost-effective compared to traditional development models. The IHAC has received many awards and recognition, such as the grand prize winner of the Healthy Aging Prize for Asian Innovation, was selected as best practice in achieving SDG, and lastly, was selected as best practice in healthy aging by WHO. To support the ISHC with their activity during COVID-19 pandemic, HelpAge International in Vietnam developed the COVID-19 manual for ISHC and local partners. To find out what were the ISHC COVID-19 intervention and their impact, HelpAge International in Vietnam conducted a rapid situation assessment of 111 ISHC from 9 provinces, of which 100 ISHC were found to have COVID-19 intervention. These were their activities. ISHC conducted rapid needs assessment of the most at-risk and needy household. The list is then presented to and certified by local authority for future relief support. Even though the government of Vietnam has numerous interventions to mitigate the impact of COVID-19, however, there were still many remaining needs and gaps. Therefore, the ISHC expanded the local resource mobilization targeting government office, private sectors, faith-based organizations, and individual donors. The ISHC representatives were invited to local COVID-19 coordination meetings. The ISHC were considered important key players in local COVID-19 control and mitigation efforts. The ISHC provided volunteers to man community checkpoints and recorded visitors' temperatures and information. Prepared meal service for staff and volunteers at community checkpoints, conducted regular COVID-19 communication and dissemination activities such as providing updates to stay connected with members through regular phone calls, to raise awareness on COVID-19 through community loudspeakers, 3. Set up online chat groups to share COVID-19 information, and provide door-to-door COVID-19 ISEC materials and encourage good practice. Supported local authorities and other organizations to conduct mobile information and dissemination. HelpAge International in Vietnam produces standardized COVID-19 message recording which the ISHC can use in their community loudspeaker information sharing activities. Mainstream new normal practice in the ISHC activities such as social distance, wearing face masks, hand washing, and regular temperature check. Support provincial health department to make liquid soap for distribution. Support local health department to conduct information sessions for trainers on the proper usage of face masks and hand wash with soap. Distribution of face masks and liquid soap. Distribution of emergency food and cash assistance to needy households. Provided special care package for older old and those that are frail. The 100 ISHC that had COVID-19 intervention had a total of 949 home care providers, providing regular home care service to 461 clients. Provide information to care provider on how to protect themselves and their client. ISHC links with local commune health stations and or retired health workers to provide regular medical checkup for their care client at home. Home care volunteers provide medical escort service to health checkup and follow-up treatment. IHSC also have social development fund which can be used to provide financial support to needy families to cover their out-of-pocket medical costs. The ISHC Living Support activity included shopping, meal delivery, running errands, house repair, and farm and yard work. ISHC regularly conduct environmental sanitation improvement in their community, such as village cleanup, improvement, and disinfection days. Many ISHC also conduct their daily physical exercise online to promote stay active and healthy during COVID-19 lockdown. Encourage members to write and share poems and writings on COVID-19 prevention to boost positive thinking and localize COVID-19 message. To disseminate COVID-19 information widely throughout the country, HelpAge, in partnership with the Ministry of Health and UNFPA, developed a series of COVID-19 awareness and training videos such as basic information on COVID-19 for older people, 10 things older people need to pay attention during COVID-19, how to protect older people in nursing home during COVID-19, care for older people at home during COVID-19, COVID-19 and older people, information for family members, guidance on quarantine at home for older people during COVID-19, and COVID-19 vaccination and older people. The ISHC can greatly support local development and emergency response if they are included. ISHC can help state agencies reach those most difficult to reach, like those living alone, bedridden, and extremely poor. Long-term collaboration between IHACs and local government service providers can increase effectiveness of service and relief support. Joint resource mobilization between IHAC, the private and public sector can greatly increase fundraising success. Thank you.